Hi, I'm Angela Odoms-Young. I'm a faculty member in the Department of Kinesiology and Nutrition in the College of Applied Health Sciences. Today I'm going to talk a little bit about childhood obesity prevention and using a systems approach. I have a cold, so my voice is a little hoarse, but hopefully you'll bear with me. Maybe the water will help. I like to move around if it's okay with you. I hate standing behind a podium. So what I'm going to talk about is childhood obesity in the U.S., talk a little bit about the solutions, and then go over quickly kind of determinants of obesity disparities, and then discuss more in detail how do you apply a systems approach and then next steps. Most of this you may already be familiar with, at least in theory. Because how many people have not heard that there's a childhood obesity epidemic? Right. I don't think that there's anybody in the United States that hasn't heard about this issue. Actually, now, which is I think probably maybe last year, they decided that September is National Childhood Obesity Awareness Month. Actually, that was new to me. How many people have seen these ads from Georgia? No. So there was a lot of discussion, even in the public media, about these ads as being fat shaming. Have you heard of fat shaming? So a lot of stigma. The ad is targeting parents with a focus on kids. So as you read the caption, it's hard to be a little girl if you're not. And a lot of the focus of the ad was around it took this sort of in-your-face type of approach. So there was a lot of debate about whether this was valid, whether it would be effective. And even with American Heart, Don't Supersize Him, the focus on now obesity in infants based on the discussion of obesity in the U.S. So why do we care? One reason is because of these national trends, where you look at where obesity was relatively stable between 1963 or even before, and like 1970, you see this rapid increase. Like a lot of people talk about over the last 3 decades, a little more than 3 decades now, you see this rapid rise in childhood obesity rates. One of the main concerns is the disparity that exists. There is a disparity in the prevalence of obesity in adults, as you would know, as you probably know. And when you look at the comparisons of non-Hispanic blacks to non-Hispanic whites and Mexican Americans, you see a disparity. This is actually in males. What do you notice in this graph? What do you see? This is male 6 to 11.
Non-Hispanic black has risen as opposed to everybody else who's decreased.
Right, yeah. That's a big issue. That now you have this rapid, you see between 2007 and 2008 and 2009 and 2010, for some reason, actually most people don't know why, you see this huge increase in males. Traditionally, when you think about children, it was Mexican American boys that were disproportionately at risk, and then African American girls. Also, this is males 12 to 19. So what do you see? You see a little bit of an increase in non-Hispanic black boys, but you don't see what you are getting at the 6 to 11 age range. So something is actually happening in the last few years of where you're seeing an increase that's different than in older children. So that's happening in younger children, that's not happening in older children. And girls have actually stayed pretty much the same, with the exception of this dip you see in non-Hispanic black girls in the 2007-2008 in ages 6 to 11. But when you go to 12 to 19, you see mostly an increase, but girls, African American girls, which were disproportionately at risk, you're starting to see a dip. So in most people, or most racial and ethnic groups, there's a thought that there may be this leveling with the exception of African American boys. But you still see a disparity that exists. There's a significant difference between non-Hispanic black girls and even Latino or Mexican American girls and non-Hispanic white girls. So this is particularly concerning given that about 80% of African American women are classified in the overweight range, have a BMI over 25. So the thought is that this is going on a direct trajectory to adulthood. And even though there is some debate about body fatness and BMI in African American women and girls, you know at the higher weights that it becomes a significant concern. So why are we so interested in this other than the fact of the disproportionate health burden on this community? One reason is that we don't have solutions. But for the most part, individual interventions are limited. So individual behavior change approaches have actually shown minimal success across the board, but particularly in black women. Most interventions are downstream versus upstream. So when we think about downstream interventions, we think about individual interventions. When we think about upstream interventions, we think more policy, systems change. So most interventions have focused downstream. And we know that individual dietary decisions actually don't take place in a clinic. They don't take place in a medical care or healthcare setting. Where do they take place? At home. At home, at a fast food restaurant, out at the baseball park. You can get food everywhere, from a vending machine. Now even you go to Office Max. You go to places, a bookstore. You can get food, places that food was not before. So most people make dietary decisions in social and environmental contexts, but we really have limited understanding of how these contexts influence diet. So how many people have seen this? It's the Institute of Medicine report that Weight of the Nation was based on. How many people have seen Weight of the Nation? So Weight of the Nation is an HBO film that just came out, but it was based on this Institute of Medicine report, Accelerating Progress in Obesity Prevention. So this committee focused specifically on how to address both the prevalence of obesity as well as disparities in obesity. So they make several recommendations. So bold, widespread, and sustained action will be necessary for obesity prevention. Priority and target actions must be driven by cultural and societal changes. So it has to be in context. And then what's particularly relevant to this talk is that they talk about cultural and societal changes are needed to address obesity, and a systems approach must be taken when formulating obesity prevention recommendations, so to address the problem from all possible dimensions. So I want to talk a little bit about this systems approach. What is a systems approach? So why do we want to use this systems approach to address childhood obesity? Hammond, in an article in 2009, talked about 3 attributes of obesity that actually make it particularly challenging. One is that it's multi-level. Genes, neurobiology, psychology, family structure, economic, social, the diversity of actors. If you think about who would be relevant to prevent obesity at the societal level, it includes everybody. It includes industry, it includes practitioners, it includes that person that's serving food at the baseball field or who's making decisions about what food is eaten. So it's a diversity of actors. Then it's also multiple mechanisms. So when you think about the multiple levels, there's researchers looking at genes, there's researchers looking at neighborhood access. So there's multiple levels, multiple mechanisms that are possible. And so when people think about a system, to address obesity, they think about all of these things. How can we think about all these things together versus just looking at genes or just looking at neurobiology or just looking at environment? So several people have tried to focus on at least proposing theories that might be relevant to this. One is an ecological systems theory, which you may be familiar with, that was originally developed by Bronfenbrenner. So where the child is in the middle, or child weight status is in the middle, but then there's child characteristics and child risk factors, there's parenting styles and family characteristics, and then of course families sit in communities. So that these multiple levels are relevant. So things like dietary intake, gender, age, TV viewing, types of food available at home, how we feed our kids, and then things like school lunch in the community. How long does a person work? Actually, I just heard a story on Good Morning America that working moms, kids with working moms have children that are more obese. And I thought, oh, I'm a working mom, you know. So it's like, are you blaming working moms? So they were like, the more hours moms work, the heavier the children. I thought that was very interesting. I was like, I have to pull that article. But they talk about working hours. So they came up with different possibilities for why that might be the case. So several people have talked about going beyond this socio-ecological approach and moving towards a more complex system. Because where we consider things like the multiple levels as both autonomous actors as well as together, think about the feedback that happens. It's not all one way. And then also think about how maybe small changes may tip the balance. This complexity really relates to health disparities. One reason is that there is a belief that health disparities are rooted in social inequality even more than things like genetic inequality. So if you consider or you just look at genes or neurobiology, that much of the equality that links to disparities in obesity may be missed. So what do I mean by that? Things like material conditions. If you don't have money, you can't buy what? Food. You may not be able to have funds to have extracurricular activities for your children. Things like racial segregation, fear of crime within neighborhoods, dietary practices and social norms, conditions in work, and then things like laws and policies may contribute to opportunities or constraints, and that this part of the model is really important, but you can't forget the genes, the immune system, the endocrine system, those regulatory systems that may interact with environment and change the outcome based on that environmental interaction. One reason that people feel like the systems approach is important is because when we think about these disparities, there's a lot of evidence that suggests that if it's caused by inequality, that the solution is rooted in addressing inequality. So this is actually me in the 70s. And of course, and if you look at the trends in obesity between 76, I think I might have been 9 or something in 76. What changed between 76 and now? What do you think changed between 76 and 2012?
More technology.
More technology. I don't know who was not born in 76. It's probably some people that were born in 76. So they, when you look at the trends, probably always, when they were born, there were technology, technology that exists, these differences that, that were already in place. But there are a lot of things that happen that change between 1976 and now, but it's also things that contribute to disparities. So there's changes that contribute to overall changes in obesity, but they also contributed to inequality, which people believe may result in disparities. So I want to go through just 3 of these very quickly. One is food availability. I'm sure many of you have heard of food deserts. A lot of people talk about food deserts. But there's also a few other things that happened. Between 1970 and 2001, you had almost a 300-fold increase in the number of fast food restaurants. Particularly relevant to disparities in African Americans is that McDonald's, which was the first fast food company to really desegregate, in 1968, there was the first black McDonald's owner. And not long after, they founded the National Black McDonald's Operator and Owners Association. The focus of this was to really bring fast food opportunities to African American neighborhoods. Since that time, they even have a Latino McDonald's Owner and Operators Association. So it says now that's 3 burgers with ketchup. This is actually an article from the Chicago Defender in the 1970s about black businesses, big business when it's well run. The officers of the Black McDonald's and Operators Association recently met with their fellow owners to talk about business models to expand in the community. So there's also changes in food marketing. The food industry and marketing actually was able to target children more. And there was a focus that children were consumers versus parents just being consumers. So a lot of the marketing shifted from adults to children. So you see like Barbie marketing, Barbie on packages. And so products and packages were in larger portion sizes. Pricing of high-calorie foods were less. And promotions where billions of dollars were spent on advertising and a larger proportion every year towards children. So when you look at this differences, or you look at the differences in marketing, some of it are ads. So there's several studies that have shown that African American and Latino communities, even with commercials, are targeted more with energy-dense foods, but also within neighborhoods. And this is a study from Tony Yancey at UCLA. What she did is she counted the billboards, and they use a rubric called sheets in marketing to, I guess, standardize the types of marketing. So they did a similar, they used a similar approach as some of the drug and alcohol researchers have used to look at alcohol billboards in communities. And they looked at fast food, sugary beverages, and alcohol. But they found in low-income African American communities and low Latino communities specifically, exceeded those ads in white low-income communities, but definitely as compared to those white higher-income communities. So the actual marketing in communities were more, in addition to the advertising that takes place. So I also wanted to show another example of this. This is the Essence Music Festival, which is a predominantly African American music festival. And a big focus has been targeted marketing. So we see this increase in marketing towards children, but we also see this increase in targeted marketing. So it almost tells the story without the sound. So people are saying, I love to come here when McDonald's is at the Essence Music Festival. I love whatever those little shakes, I forgot, since I don't go to McDonald's, but they had like a little Frappuccino-like shake. And so people were commenting, oh, these are delicious. And then people had chocolatey delicious. And then they had dance contests, and it was a lot of fun. And then I'm like, even Ronald McDonald is in the mix. So, but they definitely target, this is sort of an older crowd, even though they had Tyrese, which might appeal to a younger population as well. But they are very good at getting sort of the top stars to engage in these types of promotions. So in their targeted marketing campaigns. So there's been a change in the focus of marketing, moving towards more targeted marketing. But it's all focused on appealing to younger people. Actually, we have a project with marketing in in African-American teenagers. So I've learned a lot. I'm like, so also differences in price and income. So when we look at the consumer price index, there's been a change in the prices of fruits and vegetables when you look at the consumer price index, but those prices have stayed relatively the same since the 1980s for things like snack foods. So cupcakes, cookies, so the relative price to healthier foods to unhealthy foods is actually less. Also, people in communities of color make less. There's a higher proportion of blacks and Hispanics that live in poverty. So when you look at these stats from Robert Wood Johnson Foundation Center on Social Disparities, for all persons, you see that the percent of persons living in poverty in 2004 is higher for African Americans for all persons, but particularly in families with children under the age of 17. Okay, so lastly, there's the complexity of disparities. So we think a lot about racial disparities, but people don't only live in a race. They live in age, there's gender, there's disability. So there's a lot of intersection between these disparities. People may have multiple conditions. There's a big focus now in NIH in looking at obesity in people that have mental illness. There's geography, there's different risk factors. So disparities are actually complex. It's not just simple race. When we think about culture, it may be multiple cultures. So what do we do as far as next steps? How do we approach this? Even though people have talked about systems, a lot of this is theoretical. It actually hasn't been tested. Many people are advocating for mathematical modeling, but what do we need to inform those models? And then how do we actually look at all of these things together? Can we really use a systems approach to interventions? Because that's what's needed, at least, based on the weight of the nation and the IOM report, they're saying we need to look at these things together, but can we do it? So I just want to close with the results of the IOM report. And they talk about really targeting these systems: school environments, physical activity environments, food and beverage environments, and then healthcare and work environments, to make physical activity an integral part of a routine, integral and routine part of life, to create food and beverage environments that ensure that healthy food and beverage options are an easy choice, to transform messages, particularly focused on marketing, expand the roles of healthcare providers, insurers, and employers, and then make schools a national focal point. So I want to end there. Thank you so much.